joining. Welcome everybody to this CDI seminar. CDI is the Center for Development Impact. It's a community of practice to reflect about methods for assessing impact of especially development interventions. It's already working several years. From 2014 it was established and has regular seminars. I'm very proud that today we can hear research outputs from Inka and from Jessica of a research project which is still being analyzed. So it's a good moment of having a discussion about the methodology which is being tested there, which is a realist evaluation. Just to introduce myself, I'm the director of the Center for Development Impact. I'm IDS fellow, but the Center for Development Impact is also partnering with ITED, which is a consultancy firm, global consultancy firm, but based in Brighton and the University of East Anglia. Without much more introduction, I think Inka or Jessica, I don't know who's starting, and perhaps first start introducing yourself.
Great, thank you. So I'll kick off the first part of the presentation. So I'll introduce myself at the same time. So yeah, thank you, Giel, for welcoming us to this CDR seminar and for having us today. My name's Jessica Gordon. I'm a program manager, doctoral researcher at IDS. And yeah, really delighted to be here to talk to you today about our experience of using realist evaluation as part of a wider evaluation. Before I kick off, perhaps Inka, you want to just quickly introduce yourself as well. I know you're doing the second half, but
okay. Yeah, so I'm Inka Barnett. I'm a research fellow in the health and nutrition cluster. Yeah, I think, yeah. So over to Jess.
Great. Thank you, Inka. So yeah, so just to kind of a bit of context background for the seminar today. You know, Inka, myself, and many others in the health and nutrition cluster IDS, we've been involved in a number of different theory-based evaluations of interventions, particularly focusing on behaviour change for improving nutrition outcomes in sort of low-income country context. And we were really excited to have this opportunity through this evaluation of a particular program called mNutrition to kind of trial using this realist evaluation approach as part of a wider evaluation to help kind of unpick some of the sort of contextual intervention sort of interactions occurring through this program. So a kind of, I guess, a word of warning that this seminar is not meant as a kind of how-to guide for conducting realist evaluations or a kind of theoretical explanation around you know, the realist approach. It's very much more kind of practical explanation of how we as a team at IDS and with colleagues in Tanzania kind of undertook this evaluation and kind of our reflections on conducting this kind of evaluation in a very much real world context. And I know that you know, realist evaluations have largely been conducted in kind of developed country contexts like the UK, for example. So we wanted to highlight along the way some particular challenges around the environment that we undertook the evaluation. And yeah, this is very much work in progress, as Giel suggested at the beginning. So we'd really welcome anyone's input and suggestions in how we sort of refine the process going forward and your own kind of experiences of using this method. So yeah, Rita, if you don't mind moving us on to, thank you, next slide. So just very briefly, what we're going to cover today. So I'm first going to attempt to do a very rapid talk through of the the background to the program itself that the Realist evaluation took place in. I think we felt it was quite important to kind of set the scene in order to understand how the Realist evaluation kind of interrogated a lot of the program design assumptions. So I'll give you a brief overview of the nutrition program, and then the wider evaluation design, which the Realist component was a part of. And then I'll hand over to Inka, who will talk us through the Realist evaluation component design and present some of our initial results. And then we'll wrap up by just sharing some reflections on some of the kind of challenges that we experienced along the way in using this kind of method as part of this evaluation. Yes, so if we could move to the next slide, please. Thank you, Rita. So just a very brief overview then of the nutrition program. So really this program was designed in the wider context of the kind of growing interest in using mobile phone-based technology to support behavior change communications in low-income settings. So particularly in relation to improving health and nutrition-related behaviors, and that there is some evidence, emerging that ICT-based platforms like mobile phone messaging services can overcome some of the weaknesses of and sort of gaps in traditional health nutrition service delivery, and particularly in kind of under-resourced settings where you've got overstretched health workers, for example, unable to reach people. So this nutrition program was looking at whether mobile phones could provide that kind of customized, time-sensitive behavior change information for improving infant young child feeding practices in a kind of efficient, cost-effective way, and at scale, importantly, because that is really the kind of the key sort of feature of mobile phones that potentially give them that benefit over other more traditional behavior change methods. So if we could go to the next slide, please. Thank you. So a bit more detail about the program itself. So nutrition was a 6-year program, a real global initiative that was organized by GSMA, who are a platform that represent mobile networks worldwide, supported by FCDO, implemented across 12 different low and middle income country settings. Our evaluation focused on 2 of those, and in this presentation particularly we'll be focusing on the one case study in Tanzania. So the program itself was focused on using mobile phone services to promote behavior change and child and maternal nutrition, importantly. That was both through SMS, so text messaging services, and also voice recorded messages. And also just to clarify that there are 2 sort of main types of program that fell under the nutrition program, one looking at agriculture, so mobile agriculture services, and the other on mHealth, mobile health, focused more on maternal infant health. And so this seminar today is focused on the mHealth program in Tanzania, which was the focus of one of our case studies. Next slide, please. So I think in order to understand the second section, when Inka talks a bit more about the sort of features of the intervention, we wanted to just share a brief overview of how the sort of process of content development for the nutrition messages, because this is quite important in terms of understanding people's response to the messages. So content was developed by an organization called GAIN at kind of global level, and was then sort of translated, interpreted into the national country context for each of the countries where nutrition was being implemented. So in the case of the mHealth platform in Tanzania I mentioned, which is referred to as Wazazi Nimpendeni, this was through an existing mHealth platform, Wazazi Nimpendeni, and in particular through SMS services in that case. And really the ultimate aim was about scaling up the delivery of these services and promoting behavior change. Can we have the next slide, please? Thank you. So Wazazi Nipandeni, the SMS program that was focus of our evaluation in Tanzania, and we're going to talk more in terms of our realist design as well today. The key kind of intervention feature really to focus on is the SMS delivery, because other types of mHealth programs use different sort of technological approaches, and really this is all about the messages. And the target group that these messages were delivered to were pregnant women and mothers of young children, and also their partners. Thanks, Rita. So this slide is really just, I'm not going to talk through data, but just to illustrate the kind of messages that people signed up to the service received. And I think the key sort of intervention feature here to recognize is that the messages were very much targeted at people's sort of personalized stage of pregnancy or age of their child. So going right through from early pregnancy to when their child was up to 2 years old. That's kind of really critical in understanding people's sort of experience of the program itself. Can we have this next slide, please? Now, just a very brief overview of the overall design within which the realist evaluation fits into. So yeah, IDS together with a number of partners you can see on the slide here were commissioned to conduct this evaluation of M-nutrition by FCDO. And the overall aim really was to look at the impact, effectiveness, and commercial viability of the program itself. We can go to the next slide. Thank you. Then this just gives you a brief overview of the design itself. So 3 main components to the evaluation. We have a qualitative, quantitative, and business model components, all of which were designed to be very much interwoven and kind of draw on each other's findings throughout the process. You'll see here on the left, under the qualitative box, I've highlighted the midline, endline sections, because this is the part of the qualitative component where we built in the realist subcomponent. So for the midline and endline phases of the qualitative data collection, we had particular realist component built into that. But also to emphasize, as Inka will go on to explain in more detail, the realist component did draw very much on all these different evaluation components to kind of inform the development of the program theory that were kind of central to the realist design. So I'm now going to hand over to Inka, who is going to go into a little bit more detail now about the realist evaluation component, the bit we've all been waiting for.
Well, okay, thank you so much, Des. So to the realist evaluation subcomponent. So it is the realist part was just a small component of the entire mixed method evaluation. And I should also highlight that the mixed method evaluation of the nutrition program in Tanzania actually has finished almost 2 years ago now. And we have handed in all the evaluation reports we had to submit to the funder, but we are still working on this realist evaluation study, kind of a sub-study that we don't need to submit to the funders, but that we kind of want to pursue because it was a really good opportunity to dig deeper into some elements of the overall program, and also to use realist evaluation approaches, or to attempt to use them. That we are working on this for such, or have been working on this specific study for such a long time, kind of highlights a little bit how difficult it has been. And kind of we want to convene this perhaps with the seminar to that employing a realist evaluation approach as part of a large scale program has been really tricky for us. We have worked on it now nearly 2 years. We have a draft paper, but there are still many questions and many elements we are not so clear about how to portray them. And yeah, so any feedback or suggestions you have would be really welcome, because it turned out to be much more complex and complicated than we had envisioned it. So next slide, please. So the Realist component is just a kind of one small component that we want to use to look into two specific aspects with a little bit more depth. And the overarching question that guided the Realist component was who is likely to engage with and benefit from behavior change communication sent via mobile phone SMS messages, as was done by the Wazazi Nipindeni program, the mNutrition program in Tanzania. Why are they benefiting and in which context? So the Realist approach was kind of used to look particularly at this, at the mothers who engaged with a program and who benefited, who engaged with it for a long time and hopefully benefited from it, and what kind of contextual factors prompted them to engage. Next slide, please. Further justification for kind of pursuing this additional study, in addition to the large-scale evaluation, was that the uptake of mobile phone-based behavior change intervention is often disappointingly low, not just in our evaluation, but also in other behavior change interventions that use the mobile phone. And this is also the case, as also the literature kind of supports our finding, if the users actually don't experience any access barriers. So in many low and middle income countries, network coverage is a problem, mobile phone ownership, especially for women, and we kind of work with mothers in this program in particular, can be a huge barrier to access, and electricity can be another big structural barrier. So we are kind of interested in women that don't face any of these barriers, but nevertheless, even if women don't face these barriers, uptake of mobile phone-based intervention is often low. So we want to, in this Realist evaluation study, know why do some women who don't face these barriers engage, and what can we learn from this for future programs, and how to target future programs better to make them kind of encourage more engagement and uptake. In the mNutrition evaluation, only 43% of the treatment households actually took up the intervention. The rest of the households said they never received text message despite being signed up for the program by our team and be part of the treatment in the kind of quantitative design or quantitative component of the evaluation. Only 43% said they took up the intervention at least once, and only 18.5% of the treatment households, so only 101 households, said that they actually took up and engaged with the text messages were 6 months or longer. So the focus of our Realist evaluation component is on these women that, or these households, in particular the mothers in these households that engaged with the intervention for 6 months and longer. And we want to know, why did they engage for such a long time? What prompted them? Another
Inka, perhaps there's a question, and I also had a question about the uptake. Can you explain, because you say that the uptake is low, 43% is pretty high, I think. So what do you define as uptake?
Oh, so the uptake was so the women in the households in the treatment samples, they were signed up by the quantitative interviewers to receive this mobile phone messages with behavior change content for a period of 2 years. So 100% of the households were signed up in the treatment villages to receive the messages. But then when the quantitative endline survey went back to the households and asked them whether they have received a text messages with behavior change content, only 43% of the women said they had received a message or they had read a message. So the others, they have never received any messages, or they received messages but didn't read them because they perceived them as spam, or because they use different mobile SIM cards, and so they kind of didn't realize that they received messages with another SIM card. So there were loads of different barriers. Also, another challenge was that a lot of women kind of used another person's mobile phone number when signing up for the service. So another person got the messages or not, and the actual treatment households never received the messages. So yeah, and the 18.5% that received them for a long period of time, they reported in the quantitative endline survey that they received for several months and read for several months at least one message per month. So yeah, so they were, it's not that they signed up by themselves, they were signed up by our team to receive because if they sign up themselves, the uptake and reach is likely to be even less. Yeah. There was another question in the. Did I answer both questions, or was there another question, Giel?
I think the context question will come later after you've described it, and the uptake question is answered. Okay. Thanks, Abby, for raising it.
Yeah. So yeah, another kind of justification for why we wanted to attempt to dig deeper and use this realist evaluation approach was that a lot of the existing, or most of the existing evaluations of digital or mobile phone-based behavior change interventions that aim to improve infant and young child feeding behaviors rely strongly on experimental designs that are often neglecting the context of use and also just focusing on aggregated outcome measurements. And our evaluations, our overall evaluation of the intervention in Tanzania and Ghana also used an experimental design and reported on aggregated outcomes, of course. And for both interventions, we found very little aggregated effectiveness of the intervention. And this, in part, was explained by the low reach, by the very limited reach of the intervention. So kind of to address this a little bit, to take the context more into consideration and kind of learn more about how the context of mothers kind of interacts with the intervention and how this might kind of trigger some internal processes that then will lead to continued engagement, we employed the realist evaluation approach. Next slide, please. So the objectives of our realist evaluation were to, on one hand, look at underlying change mechanisms that were related to the delivery of behavior change communication via SMS messages. So we were particularly interested in what impact does delivering behavior change communication via SMS have. And the justification for this is that there is literature that suggests that the delivery channel for behavior change communication can have a huge impact on uptake, and in some cases might even be more powerful than the actual content of the behavior change communication. So we kind of wanted to learn a bit more whether the delivery via SMS has any kind of additional or special impact on uptake and engagement. And the second objective was to identify contextual influences within the mother's context. So the mother's kind of her own situation, her household situation, but also the wider her wider context and how this might have an effect on how she responded to the SMS-based behavior change communication. So two kind of aims, one around change mechanism linked to the delivery channel, and the other one around contextual influences that affect response to the intervention. These two are really strongly interrelated. And this is one of the struggles we face, how to write this up, how to communicate it in an accessible manner, and also within a word count of a journal paper, for example. Next slide, please. So just really quick recap. There were several CDI seminars beforehand that went much more into detail with regards to Realist evaluation and what it is and how to do it. So to briefly recap, it's a theory-based evaluation approach. Is based on the assumption that a program such as this mobile phone-based behavior change intervention introduces new resources into a system. And when these resources interact with a specific context of the recipient, so with a kind of context of the mother, this may trigger some internal processes within the mother that then might result in continued or ongoing engagement with the intervention, and hopefully then also behavior change in the kind of as a second step. One of the key elements of realist evaluations are this contest mechanism outcome series that kind of say that within a kind of a program introduces a resource that within a specific context can then spark this internal mechanism, which then leads to the outcome. And realist evaluation also seemed a good choice for our study because it really clearly acknowledges that mothers might respond very differently to the behavior change communication sent via SMS, depending on their specific context and depending on what internal mechanism might be triggered by this interaction between resource and context. Next slide, please. Oh yeah, this is just to kind of highlight what a CMO is again. So context plus like within a context, the resource is introduced, and then this will create a reaction by the mother, an internal reaction. This together is the mechanism, and this will lead to an outcome. Next slide, please. So how did we do it? So we followed this evaluation framework suggested by Porson and Tilly, and in the paper that we're working on, we follow the reporting guidelines suggested by Ramses to kind of structure and make sure that we report all the kind of important methodological elements in a transparent manner. We started by developing the initial program theory and a number of initial CMOs that we then tested and verified in mainly qualitative case studies. So we mainly drew on the qualitative data. Also, the sampling for the case studies was very strongly informed by the quantitative surveys from the overall evaluations. And then we kind of tested and verified and added more theories to kind of try to address our two objectives. Next slide, please. So the initial program series and the initial CMOs were developed in a very iterative, very time-consuming process that took many months and over several years also, because we had 2 data collection rounds, 2 years or 1.5 years apart. Initially, before the actual empirical data collection started for the Realist study, we kind of developed the initial theories using a literature review that we had done in the initial phase of the overall mixed method evaluation. We reviewed the program documents, we interviewed the different program stakeholders globally, as well as in Tanzania several times. And also we draw heavily on the quantitative baseline findings for our sampling in particular, and learn more about how people, our mothers, may receive kind of digital information and also their knowledge on infant and young child feeding behaviors at baseline. We also did an initial qualitative explorative study before the intervention was rolled out in 6 very different sites in Tanzania to inform our initial theories. Also, and this was another really difficult, very time-consuming part, was we tried to inform our CMOs by theoretical work on innovation, uptake, and behavior change. But this is something we struggled with because initially we didn't know what theories to draw on. Then we identified several theories that fitted really well for kind of our initial data, but we didn't quite know where to stop. We went into different disciplines and had in the end kind of 30 different CMOs that we tried to narrow down again. And so this was a very difficult process, which, especially if a realist evaluation approach is used on a much tighter time frame, might be a challenge. How to put boundaries or how to focus in. Next slide, please. Oh yeah, the initial kind of overall program theory was kind of also informed by how the program itself defined the pathway of change. So behavior change communication for improved infant and young child feeding behaviors, sent through SMS messages to mothers when implemented in a context of poor nutrition service coverage and overwhelmed nutrition frontline workers, will increase mothers' awareness and knowledge of optimal infant and young child feeding practices, which then will lead to improved practices. So this is very strongly informed by the program's own theory of change, but we kind of made it a bit more specific. And then we had a list of, I think initially 6 CMOs of how mothers engaged with the service and kind of internal processes that might be triggered. Next slide, please. So we then started to test our initial series in drawing especially on the qualitative data collected from 3 purposefully selected sites. They were all 3 treatment sites in the overall evaluation. Within this treatment site, we defined cases as mothers who they were purposefully selected and they had engaged with the intervention for at least 6 months. And we kind of identified this using quantitative endline data and here exposure to the intervention. So mothers who had said that they engaged for at least 6 months, they were kind of eligible to be part of our realist evaluation. Next slide. We did 2 phases of qualitative data with the same mothers at midline of the overall evaluation. Of course, at this point, we didn't know whether they would engage for a long time period. So the qualitative sample at the midline was much bigger than the sample that was drawn from the midline for our realist evaluation component. So the realist evaluation is only focused on the women that had engaged for 6 months or longer. We did 2 data collection rounds with them. We used a kind of flexible, semi-structured topic guide. And the topic guide was on different issues around the mixed method evaluation, but we had one kind of lot of questions, kind of, I think 6 or 7 questions that were specifically focused on our realist evaluation. And this was another challenge because we tried to integrate more realist evaluation style questions into a topic guide that was part of a larger evaluation. The interviewers, the field workers that would do the data collection in the villages really struggled with this realist type of interviewing. So the idea was that with the topic guide question, we would introduce to the mothers some initial theories of how the intervention would work or what kind of internal process it might trigger, and then wanted them, the mothers, to reflect on this and kind of either confirm our theories or develop them further or reject them. But for the field workers, this was really difficult. They kind of said these are not typical qualitative open question. It feels like we're really guiding the mothers into one specific direction. So we had to edit and modify this realist evaluation part of the topic guide quite a lot, because the field workers really struggled with this and how to do it better. I think this was interesting learning for us to do realist evaluation with field workers that are not used to this approach. Might be really difficult. Also, it should be highlighted that a lot of the interviews were, of course, in a different language. So our quite complex theory-based interview question would need to be translated often on the spot by the interviewers in the field, which was another challenge. And then we use thematic coding, really informed by the CMOs to extract the data. Next slide, please. This is just to show you a part of our attempt of doing a realist evaluation informed topic guide, or some questions in the topic guide that have more like a realist approach vibe. So in the first one, we have a few questions that try to look at mechanism in particular. So we asked, for example, do you think the fact that the behavior change communication was sent via your mobile phone? Oh yeah, this was the overall question. And then the second one is, do you think it had an impact that you could read them in private, that you could read the messages in private? So this kind of tried to test this feature that mobile phone messages would be private, because the data suggested that this was kind of a specific feature of the intervention that might kind of trigger women to engage with it. And then the second kind of number of questions, they were all around the context, the health system context, the household context, and then there were also some individual context question where we try to just test our initial CMOs. But yeah, it was really a bit difficult, and yeah, not sure how well it worked in this large scale study context. Next slide,
Inka,
please.
there is a question from
Yes.
Abby Claire. Perhaps, Abby, you can just unmute and show yourself and ask the question yourself.
Oh, sure. Hi, thanks. Yeah, I just wondered where the field workers came from and whether they had a lot of experience. It sounds like they had a lot of experience doing qualitative work before, but then I wonder, were they themselves confused by the realist evaluation approach, or was it more that they're worried this is too complex for the people we're interviewing?
No, thank you, Abby. So the interviewers, they were very experienced qualitative interviewers in Tanzania that we had worked with even in previous studies. They were confused by the realist evaluation question or type of questions we had developed. They were also worried that some of the questions were just too complicated, and they just felt generally uncomfortable with asking so guiding questions. They wanted to ask much broader questions. So they were happy to have prompts. So we in the end ended up having a lot of prompts kind of that were linked to specific theories we had. And we kind of told them, which was also different from their usual experience. So we told them, you have to use all, or make sure you use and ask all the prompts. Because normally prompts are just something, if the mother wouldn't talk, they used to encourage her or to give her some ideas. But here we basically had an interview instruction, please ask all the prompts, which they kind of, I don't know whether they actually do it. Some interview transcripts, they seem to have this part missing, or this part was really short, because it just was so unnatural to them. So yeah, perhaps there are better kind of ways to do it. But when we developed this questions, it's already quite a few years ago, and we looked for examples of how to do a topic guide, a realist informed topic guide, but we couldn't really find anything. So we tried our best, but I say it's all a bit awkward. And yeah, so we had a whole session on realist evaluation and what it is for the interviewers, but not sure whether this helped or actually made it more difficult.
All right, thank you. It's really helpful.
Can I just add to that quickly?
Yeah,
just that, say, in addition to not finding much literature evidence out there on the actual realist interviews, we found basically nothing on evaluations that were putting a realist interview into a bigger evaluation. You know, the kind of design that we had seems to be fairly unique. So, you know, it's kind of partly why in doing this seminar, we hope to kind of shed a bit of light on the challenges in doing that. So yeah, this is definitely one of those key challenges in doing, you know, when you haven't got all your resources and time invested in just the realist interviewing process, but it has to fit into the wider tools that you're developing.
Inka and Jessica, one of the questions, or the simple questions, which and perhaps you ask them in another module, is to ask them, why do they think that other mothers don't use the SMS services? It's an open question. It's often quite straightforward. Then all the answers that they give are relevant for realist evaluation.
Yeah, this is true. Oh, yeah. Okay. So initial results, and here it becomes even more challenging, I think. So next slide. So kind of to recap, we had this objective to look at the specific features around the SMS-based delivery channels and how they might have triggered mechanism. And the second one to look at in contextual influences that might have kind of interacted with the intervention and then led to different outcomes. So these two are really strongly interlinked, and we initially kind of reported them quite separately, but then we realized actually we are repeating context and features all the time, and it all became a little bit too long and very repetitive. But yeah, to start with the change mechanism or linked to features in the SMS-based delivery, we identified in the qualitative analysis 4 key features in the SMS-based delivery of the behavior change communication that seem to trigger some responses in the mothers depending on their specific context. The first was that the messages are asynchronous. This means they can be accessed and read when and where the mother wants to. This was a feature that was highlighted by a lot of mothers, that this kind of was important for them. The second one was the privacy of the messages. The third one was the regularity. And the fourth feature was about perceptions around the sender. And here in particular, the perception that the sender was the government. So it was a official, almost an order sent by the government to kind of follow this infant and young child feeding practices. And a number of different mechanisms and feelings were triggered by these features: feeling assured, feeling respected, empowered, feeling acknowledged. Next slide, please. I have on the next slide just an example of 2 CMOs linked to 2 different features. There is in all, we have, I think, 8 or 9 CMOs linked to the 4 different features and linked to kind of specific context. So to give you an example, the first CMO was in the context where mothers lack the time to seek reliable information because of their daily burdens and because they're overwhelmed, but they perceive this internal need. So this was an important contextual factor, the kind of mother's receptiveness and perceived need for infant and child feeding information. If they can access the information on their mobile phones at a time and place convenient to them, this will provide them with reassurance and relieve them from feeling guilty, and also from kind of the stress of seeking information, leading to continued engagement with the messages. So this was one of the kind of the CMO, and we have a kind of a number 8 different CMOs where the specific feature together with the context triggered some feeling in the mother, which then kind of encouraged her to continue to engage and read the messages over 6 months of time, and often also encouraged her to try out at least some of the messages. Next slide, please. So additionally to the CMOs, we also have kind of case examples for each feature, where we have quotes of what specific mothers say that are in support of some of the CMOs. So just to look at the case example 2, here the context is a 41-year-old mother of 4 children who runs a shop and who also works daily on her family's farm. She's kind of overwhelmed with everything, and regular tailored text messages sent to her own phone give her the feeling, kind of, as she said, I feel good in my ear or my heart, I think, when I receive a message because they care for me or care for us without discrimination. I feel special because of being remembered. Once I open the message, I become satisfied and motivated to read it. So kind of the regularity of the messages, of being seen and being cared for on a regular basis, was a reason for her of engaging with the kind of the intervention on an ongoing basis. And we have kind of case examples for all the different features to illustrate it a little bit more. So we are not quite sure how to present it, whether we kind of, at the moment, we are presenting the CMOs and the case examples in our paper, but yeah, there might be other ways. Next slide, please. And then just very briefly, the second objective was to look at contextual influences that might play a role in mothers' uptake of the program. So we identify 3 different contexts with loads of different aspects within each context. So one was experience with a healthcare system, the intra-household dynamics, and the third one was maternal internal kind of context, and here maternal receptiveness to behavior change in information and also her internal motivation. So in the paper, we currently have a narrative on each of the context. For example, with a healthcare system, there are different variation of experience with a healthcare system. So from getting a lot of antenatal care with nutrition information and using the messages mainly as a reminder and prompter to follow up on internal motivations, to the other side, having hardly any nutrition information from the healthcare service or feeling stigmatized and judged by healthcare workers. So different healthcare settings the women were in and how they experienced the healthcare system prompted them to engage with the intervention on a kind of a longer term basis. And the same is the case for intra-household dynamics and also maternal receptiveness or lack thereof to behavior change communication. Next slide, please. Yeah, our experience, I don't know, Jess, do you want to do it or should I do it? So our experience with using the Realist evaluation was not, yeah. Jess, do you want to oh, you're muted?
Yeah, sure. Yeah, thanks, Inka. Yeah, so I think, you've referred to some of these challenges sort of throughout the presentation, but this image probably summarizes some of the key moments in trying to grapple with the Realist methodology. If you could go to the next slide, then we're just highlighting a couple of sort of key areas where, reflecting on using this particular method. So yeah, I think the first is just to acknowledge that we, despite all its challenges, we did find it actually a really useful and kind of interesting method to apply to a wider mixed methods impact evaluation. So kind of building on, I guess, how we would normally conduct a theory-based evaluation to really drill down into the detail on the context-specific factors that affect, how individual mothers experience the intervention, and really kind of interrogate those responses that mothers had to particular features of the intervention, the SMS messages that Inka's just kind of talked us through. However, equally, that didn't come without its challenges. And I think, to be honest, the main areas we struggled a bit was the sort of the complexity of using the method itself and the amount of time needed, both within our IDS team and also in supporting our partners who are conducting fieldwork in Tanzania to get to grips with the method and kind of apply it to our tools and analysis. Even though we had quite an extensive period of time overall for the evaluation, it was a 5-6 year program we were evaluating, and we had a lot of different resources to draw on, generated through the evaluation. So all the quantitative documents and survey sets, we still found it, quite a time-consuming process to sort of work through. Inka's already sort of referred to the theory development part of that, but then also I think importantly, where perhaps we could add to the learning on this more generally is around in particular contexts where we were doing fieldwork in Tanzania, and training up field workers who hadn't experienced the use of realist methods before. I think that was something that we did find particularly challenging, and making sure that in line with the realist approach that was done in a kind of iterative way. We were able to kind of modify our tools as our theories evolved. And then the third area of learning that we're still grappling with, as Inka mentioned, is the sort of challenge then of how to condense and present the findings from the realist evaluation in a clear, concise way. And that very much depends on who you're having those conversations with and who the information's designed for. So Inka's already mentioned that the M-Nutrition program itself is now completed, but there's obviously a much wider sort of evidence base we're hoping to inform in better understanding the kind of mechanisms of behavior change interventions. So that's really kind of at the point we're at now, is trying to figure out what next. How best do we make sure that we're sort of sharing our own learnings from the realist evaluation in a coherent way.
Thank you, Jessica and Inka. Time-wise, some people will leave perhaps in some minutes. There will be a recording of this later on the website. We plan to go a little bit beyond the 2 o'clock or UK 2 o'clock to discuss further ideas which could help them in developing the approaches. But the floor is you. Who has some questions or suggestions which could help Inka and Jessica to work on this realist research?
Could I come in here? Is it okay for me to go ahead?
Yeah, go ahead.
Actually, well done, both of you. I think, and so my question is more of a philosophical point. You talk about the difficulties of trying to interpret and develop clear messages and so on, and you bring this as a sort of negative thing. But is it, in fact, a positive thing that within the umbrella of the whole evaluation of all the different things that were going on, maybe you with your sample of mothers were sort of striking at what was really going on, and that perhaps some of this can't just be easily compartmentalized? What did the other team members think about your struggles?
Yeah, should I start, Jess? Well, so yeah, I completely agree, Richard. So thank you first of all, and I completely agree that some of the elements are really interesting, and there is not so much on like how mothers engage, why they engage, in what context. And this is also actually where some of my frustration comes from, because we are sitting on this paper, we don't know how to wrap it up. It's all so complex. Every time I look at it, I have new things that we should integrate or we haven't kind of looked at sufficiently enough. So it's all delaying bringing it out there. So as a nutritionist, I really would like to kind of share it, because I think there's still so much digital behavior change intervention are going on without seeing or without looking into all these different kind of contextual elements that can have a huge impact on uptake, and that could be addressed in promoting the interventions, for example. But yeah, I don't know other team members. I think it's more something we did, kind of Jess and I worked on kind of together. Yeah, I don't know. There is not so much interaction. I mean, the quantitative team is aware of it, and we always, and this was also one of the comments, I think, we always had the idea of kind of using the quantitative impact findings more and looking, for example, at actual impact of infant and young child feeding knowledge and behaviors, and extract this data for the 34 mothers from the quantitative data. But this also has been really tricky. And then also because the sample size is so small, they are in just 3 sites. We have no control group, but do we need a control group? I don't know. So these discussions we had a lot. And also another link to this, do we actually look at the impact of the behavior change communication? Because I don't think we are looking at the impact of the behavior change communication. We are looking at the impact on uptake. The behavior change communication would be kind of almost a different lot of CMOs. But then there are lots of contextual issues that affect, of course, behavior change that we haven't looked at. So it's all kind of a never-ending story a little bit. Yeah.
I have one question based on this, Inka, because often in realist evaluation, you have the question, why does it work for whom under what conditions? But often there is a sort of research perspective to understand the mechanisms of the why, and it's very much that you are in that school. But there's another school which looks at why doesn't it work? So trying to identify the contextual elements or the factors which make that SMS messaging on mobile phones in Tanzania on health issues doesn't work, and perhaps that is a way to disentangle. If you can say something about those mechanisms, then it's a more direct response to an evaluation question, because it for me at least, realist is often a critical reflection on some sort of silver bullet thing, and you really with the silver bullet here with the SMS messaging. So that question that it doesn't work always, but also under some conditions which need to be present, could be a way to draw a conclusion.
Yeah, so this is, we kind of now almost purposefully removed all the ones it doesn't work, because the challenge is that it doesn't work for most of them. And one reason, at least this is what we found, it not generally, but in nutrition, it doesn't seem to work for a lot of them. And a huge reason for this is this structural barriers to use. So if we want to kind of, because they don't have a mobile phone, mothers don't have access to a mobile phone, or the husbands don't share their mobile phone, there's no network coverage, there's no electricity. This is a huge barrier why a large proportion of our treatment households don't engage with the intervention. So if we bring this in, I kind of, or we always felt then it would be too broad, but perhaps we can look at women that don't experience this access barriers that are already discussed widely in the literature, but that actually don't experience any access barriers, but they still don't use it. So
that's what I mean. You analyze why people use it in spite that other people don't do it. So what are the contexts which explain why that they do it while other people don't do it in general?
To add to that, I mean, Inka, we do within the sub-sample of women who are active users, or we do have some CMOs, some negative CMOs already, where, you know, for example, I think one of the big ones that came out of the data was around, you know, limited resources. That meant that even if women, you know, appreciated the message and wanted to act on them, they weren't able to because they didn't have the financial resources, capacity to then follow up on the information. So I think I think that's a really nice idea, Giel, and we can kind of maybe build on some of those negative CMOs already within that group we have, without getting too big.
And but then linked to this is also like to separate behavior change content from the delivery mechanism. Because then like if our aim is to really look at what impact does this delivery mechanism via SMS have additionally, or to just behavior change communication through other channels, then if we look at why they don't engage because they don't have the resources, then it's more about the behavior change content than the delivery mechanism. Yeah, I thought a lot about so it's,
but perhaps somebody else has a good
so
insight
it's really,
to the floor. Somebody else who has some questions around these issues or experiences. Abby.
I was just thinking about the integration with the quantitative. It sounds like you know it's slightly separate, but the quantitative data should also be able to show you on a larger scale, like who didn't take it up because of barriers, like structural barriers. And I'm just wondering, well, I don't know if they collected information about knowledge or attitudes or, you know, any other kind of intermediate outcomes, but it'd be interesting, given that you have worked in relative isolation, whether their data would back up your theories from your smaller sample. Whether they do any extra analysis for you, I don't know.
I think this would, this is possible, and they have all the outcome kind of data on behavior and knowledge, and also a little bit on exposure. So we could make exposure perhaps an engagement one of the outcome indicators we look at and see whether the barriers have an impact. But we also kind of struggle how to present this then. It's kind of, do we present this as the overall sample and then additionally have a quant table just for our 34 women? These are some of the kind of thoughts we had.
There's a slight kind of methodological challenge there in comparing two very different data sets, essentially, because we've got a very small qualitative
but I
sample.
think the question which you answer is the same. Does it work? So if they say, okay, it doesn't work so good, there is not so much uptake, that's the quantitative result. That's a good finding. It's disappointing for the intervention perhaps, but that's how it is. I think the realist take would be to nuance that initial theory that it works, and to say, okay, it only works under these conditions. So then your conclusions could be to the provider of those SMS services and say, okay, if you repeat it again and you do it somewhere else, think about this. You need to create the conditions that people really do it. So your conclusions are not quantitative or so, they are recommendations for the people who implement that theory or that technology or that paradigm of behavior change.
Yes, a good idea, I think. Thank you.
Could I ask just a quick thought on some of the methodological issues you raised, because I found it really interesting. It's about the hierarchy of research, I suppose, and the extent to which you have control over the people who are actually collecting the information. Because I found this some years ago when I tried to modify a qualitative study to gather quantitative information, and using very good qualitative researchers, it was a bit of a disaster because they absolutely insisted on sticking to their learned procedures. and found it really, really difficult to adjust those to use a new approach. As far as I know, most realist studies have been undertaken by teams which have been very heavily committed to the realist approach, rarely by large numbers of people who've been brought in from outside to, as it were, collaborate. And there may be something about this process that we've been pushing the idea of participatory research for so long at IDS, and this idea of collective working together and interchange of ideas and negotiation, that when you try to shift away from that, it really looks as though you're tearing up the rule books, and people are just not willing to go along with new approaches. So there may be an interesting methodological discussion paper here, actually, about what extent one can modify qualitative approaches to collect different types of information, and particularly maybe relating to realist evaluations.
Yeah, so that's a good idea. And yeah, that's I think we saw this also a little bit, even within the qualitative stream, there were kind of hierarchies, and I think the kind of the actual data collectors, they kind of had to report to their supervisor, and they were really in a conflict what to report, because they had been trained and they were monitored to use the typical qualitative methods, but now we asked them to do something quite different. So it was yeah, kind of tricky discussion. I think in Ghana it was a bit easier potentially, because they are the field workers or the kind of team we collaborated with, they work a lot with IDS and use a lot of participatory methods, and Robert Chambers had been there and worked with them. So they were a bit more open to trying something new and actually quite excited, while the other ones weren't so much in Tanzania, I think. I don't know, Jess, what do you think?
Yeah, I mean,
yeah.
I just kind of related to that, I was just thinking, I think that there's another challenge around how much of the kind of theoretical, quite sort of academic thinking that goes into the realist method is necessary for those that are whose role is purely to sort of collect the data. So, obviously, if you have the kind of luxury of conducting a fully, realist evaluation, where the team, as you mentioned, Henry, are kind of, that is their thing, and they're fully kind of immersed in that approach already, then I think that's brilliant. But we were dealing with a very different sort of context, and so I think, given the complexity of the realist approach, it might be worth it in thinking about lessons learned, to how much of that theoretical understanding is needed to apply it in the field, I guess.
I was a bit surprised about how difficult the questions were. Confused, especially when you do it in another language. Normally you do some sort of pilot, and it would appear in the first pilot already that the questions are very difficultly phrased, and you needed to simplify it anyhow.
Yeah, this is what we did, and then we simplified them so much that a lot of the theory testing kind of, we had to remove it because it was just too complicated. Or the interviewers kind of changed the questions, and then they were so different that we didn't really see the theory anymore that we wanted to test. But we had to, it was like a negotiation. We cannot force them to ask really complicated questions they don't kind of support. So it was, so some of the questions we had there, some of the more complex ones, they are not in there anymore, or they just became short prompts. Yeah.
But actually, can I just add to Inka, though? I think that's perhaps where the benefit of sort of nesting the realist evaluation in a wider evaluation worked to our advantage, because even though, in parts of the research where we weren't specifically testing our theories, we were still able to use, those other sources of information to feed into our CMOs and our sort of final analysis. So I think, yeah, we were still able to access different sources of information, not necessarily through the Realist section of our tools, I guess.
Yeah, this is true.
Other questions? Of course, we didn't resolve the whole issue, which is always the issue in realist evaluation, is how do you disentangle context and mechanisms and outcomes, and what is the initial theory about? Is it about understanding the mechanisms, or is it for understanding the context? Which I think in this example, so that there you see that the difference in approach. And I was in a realist conference, and then of course the consensus of everybody is now never think about mechanisms or context factors in isolation. It's always the configuration which matters. So it doesn't really matter what's a mechanism or context when you always discuss what works for whom under what conditions in one thing without separating them. Because then you have mobile technology for SMS to women works with this mechanism only under this condition, or especially under this condition, and you don't split them apart. I think that's, or for me at least, without having much proof that it really works, but I think it is the way forward, that you don't try to isolate C's and M's separately.
We had a long kind of discussion and exchange papers constantly where they did it this way or this way. At the moment, we kind of have to the idea of presenting the CMOs linked to the mechanism and then discussing the context, but then the context is somehow not linked. So perhaps it would be better to discuss CMO by CMO by CMO, but it doesn't seem
but for
to be
me,
so
the context is only when it is relevant context. So a context which doesn't really have an impact on your mechanisms or in your configuration, why mention it? Of course, there are thousands of contextual factors which may play a role, but you want to distill the ones that are really making a difference between being more successful or less successful, or inclusion, exclusion, or so then coding them together is perhaps better than separating them out and then losing track when you review your codes. The ones that are still in the call, some people who have experience with other type of realist evaluations, which they want to just briefly tell something about how they resolved that issue of maintaining a CMO perspective, but coding C's and M's and O's from information that is provided by others for you to analyze. No? Other questions?
Sorry, could I come in again as no one else is? I mean, this is my old hobby horse about how, we often, particularly in IDS, bang on all the time about complexity, and everyone nods wisely and says, yes, it's all complex and so on. And this one could say is an example of complexity, but I think a lot of people, program officers in the field, need to have some guidance at what level or in what way perhaps they can be, what's the word? They can come to more common messages. I can't think of the right word I'm trying to say now. To not. I can't remember now. At what point they have to have some sort of overall classification that doesn't take into example every single bit of complexity here and there. Russia, well, I'm sorry, there's one word that I can't think about what it is, but it involves a sort of
I think Paulson and Tilly, the middle range theory, exactly the definition, I think, which they gave to it, it's sufficiently granular to give guidance to people when they do similar things again. But it abstracts a little bit from the real contextual embedding and complexity. So you try to give some sort of good or guidance for better practices or principles or whatever, but the guidance for future implementation.
Yes, in what way can you impose, given that you can't design a program for every single person in that program, at what point do you have to have some sort of level of uniformity?
Yeah.
And actually, I'm just thinking in terms of our example with the mNutrition program, where you have particular target groups or subgroups. For example, mNutrition was meant to be targeting extreme poor mothers, and that's something that differed, kind of built into the original design, but was partly lost in the, I felt a little bit anyway, in the overall implementation of the program. And so yeah, I think Richard's suggestion of kind of categorizing by these different groups could definitely help with future kind of designing, programs targeting particular context for particular types of people, if that makes sense. Yeah. Yeah.
I mean, I guess a useful program learning would be if you gave the mothers phones who didn't have phones. Would you say from your findings that it's likely that then they would respond well, or is not having a phone a function of a socioeconomic characteristic that also means they can't take that information on board? It's hard to answer, but that's the kind of thing I guess FCD I might want to know.
Yeah, I think it's similar type. If you would do it again, or if you would resolve a constraint, would it work then? And for whom? And you can also, it will always be that you can refine that recommendation domain of a technology, I think. But at least it's not working for everybody. That's clear. So what's then the how granular are you going to be with recommendations about for whom will it work? Likely under what conditions? You start with a typology. Within the typology, likely you have even more heterogeneity. So you need to stop somewhere, like Richard says, also for reporting purposes. Typologies don't need to be more than 6 or so, because then become too much. But yeah, so how do you get a meaningful mid-level or middle range theory about the use of, or the usefulness of mobile phones for health messaging could be that's a challenge. You need to,
if researchers who look at things in depth don't come out with this sort of guidance, then program staff who are well informed and focusing on implementation will do it anyway. So it's not a case of us pleading it's all complex and we can't say anything anymore, and that's it. So I always find these discussions that program staff are all too well aware of complexity because they live with it and work with it, whereas perhaps researchers are hold back from making those sorts of statements.
Yeah, I think which is the question where Jessica started with about do you really need to embed the initial theories for realist evaluation in the academic literature or the behavioral science or psychology, or is it more pragmatic, like Richard in my experience also is more it's the theory in the heads of the implementer. And it's based on some type of theory. They're not stupid, and they all graduates, etc. They are professional people, but they have quite a simple theory in the head, and then the realist process of making it a bit more complex, or at least identify contextual constraints to it. It doesn't work for everybody, but it needs to be this type of conditions. Is then quite a logical step without too many theoretical baggage to do before. But I know that other people who do realist research are very much on the other extreme to embed it in academic research. But I think it taking their views and then refine it at least gives you a way to write a report, which is linked to the overarching question: hey, does it work, or are we just throwing money for nothing?
I mean, we all approach a situation with a theory of change, whether we know it or not. So maybe one of the great contributions that researchers and realist evaluators can make is to uncover and illuminate the theory of change, so that people who have to take decisions and implement and use resources can refine their theory of change based on what's been found out. So that would be very useful if that's what actually happened. But I think on the complexity side, we must know when to stop, because otherwise it doesn't become very useful.
Can I just ask what role the implementers played in the initial stages, and were they involved in formulating the program theories that you started from?
No, I can answer, Jess. So they were. So there is, for example, there is not really a real theory of change developed even by the GSMO headquarter as a really high-level marketing theory of change, and also mNutrition had also different business kind of aims. It wasn't not just really just about infant and young child feeding. So they weren't really involved, and within the countries it's the mobile phone operators, and they weren't really interested in theory of change discussions at all. So no, the implementers were perhaps different, kind of as a funder was more interested in it, but even there in this particular program it was very high level, not kind of assumption risk type of theory of changes. There was not a lot of theoretical thinking.
That's interesting, because I mean, as Richard was saying, you would assume that, as it were, the people on the ground implementing these programs would at least have, though they wouldn't call them theories of change, they would have some idea as to what they were doing and how it was meant to work.
Say whether it worked.
Well, how it was meant to work.
No, it was all just it was very kind of simplified thinking about behavior change, that you give information to mothers and then everything will get better without kind of complexity. Even their narrative around the theory of change was very high level. Just be raising awareness and knowledge, and then behavior will change. But then even at the baseline, the quant baseline, and also the qual initial studies, we found that actually knowledge was quite good. So there wasn't really a knowledge gap in infant and young child feeding behaviors to start with. There was a gap in more practical operationalization of advice, but not really in higher level advice that a lot of the messages convened anyway. So yeah, so there were shortcomings in the program design, definitely.
Hey, Inka, perhaps to finish, would you recommend using mobile phone for health messaging?
I think personally, and also based on our evaluation, I think pushing messages is too narrow. They need to be interaction, but there are pathways also coming out from our realist study that would make it a very useful tool, like giving mothers acknowledgement. A lot of lone mothers, single mothers or young mothers, they said they felt really isolated and lonely, and getting regular messages really helped them to get through this really difficult time. So there are different kind of ways of how it can be helpful, but definitely I don't think it's a good investment at a large scale. The messages need to be much more tailored. They need to be much more specific, much less generic advice pushed to women who know the advice anyway. So yeah, I don't know, Jess, what do you think? I'm not so positive about it, but it's, yeah, I don't think.
I mean, I think my take is more that if you can overcome sort of contextual barriers to actually accessing the information on the phone, then there is quite a, I would argue, a strong benefit, motivation for women, for people to change their behavior, at least where those barriers weren't evident. It seemed to me that mothers were changing their behaviors, but this comes back to the kind of complexity question here, that it's very hard to kind of give a definitive answer to that, because of the very different experience that women, mothers particularly, faced with the program. So
that seems like exactly the sort of question the quantitative data could help you answer, though. If you look at the sub-sample of women who can access a phone and then look at their behavior change, like there's a lot that could be explored through that in tandem with your qualitative. I don't know if you can ask them to analyze it in a different way. I don't know.
Yeah, I mean, we analyze the quant data ourselves also, and the challenge is always having access to a mobile phone is quite like, what does it actually mean? Having access once a month, or having access whenever you get a message. So there were loads of kind of additional steps that the quant wouldn't give. So yeah, but definitely there is some kind of exposure, and some of the barriers we can explore quantitatively. Yeah.
Hey, I see that some people are slipping out, and I think rightfully, because we're a bit over time. I think it was a very interesting discussion, and very nice that you are struggling with things. So it makes the thinking and the discussion more interesting than when you have found the silver bullet. So thank you, Inka and Jessica. And thank you all for participating.
Thank you so much
Thank you
for
very
coming.
much.
Thank you.
Thank you. Bye.
Bye.